Hello everyone, welcome to my YouTube channel. So welcome to the part 3 of the video series where I'll be discussing the resources that I stuck to for my NEET PG preparation. So yes, let's get started with the last video of this video series where I'll be giving away all my third year plus fourth year subjects resources. So let's begin with the third year subjects. Okay, beginning with ophthalmology. So for ophthalmology, I had followed handwritten notes of Utsav Bansal sir of Marrow. Okay, also followed his video lectures, all his video lectures. And also for my revisions, I used to watch his video lectures again and again, okay, on the topics which I found difficult. For example, abnormal pupils, okay, of neurophthalmology, then retina, glaucoma, squint, gaze palsies. So all these topics I found extremely difficult, and yes, ophthalmology was my weak subject. So yes, I used to watch the main video lectures again and again for my revision as well. So I didn't watch any particular revision videos as such. Okay, for MCQ discussion videos, I watched again Utsav Bansal sir's videos plus Sudha Sitaram ma'am's MCQ discussion videos. Okay, when I got an academy subscription, I watched her classes, MCQ discussion classes for INICT, for NEET PG, and all of them were really helpful. I loved it. So yes, if you are having access, so I would definitely recommend you watching her videos. Okay, now coming to the question bank, I followed Marrow. I solved Marrow question bank again, and SWT, of course, Marrow plus prepladder. Right. So done with ophthalmology. Coming to the second subject, ENT. So for notes, I had handwritten notes of Rajiv Dhawan sir. Earlier he was in DAMS, now he is in doctoratorials, and I watched video lectures of Manisha ma'am, Marrow. Okay, so Manisha ma'am, and yes, once you listen to Manisha ma'am, you'll feel ki you can listen to her all day. So yes, she teaches really. I mean, I had heard about her even before I had taken Marrow subscription. Two teachers I had heard of. Ki you must listen to them. One was Sakshi Arora ma'am, and another one was Manisha ma'am. So yes, when I watched Manisha ma'am's video lectures, I realized why people talk about her so much. Yes, she's a treat to listen to, Okay, so yes, Manisha ma'am. And revision videos, I followed RR, okay, prepladder rapid revision. So different platforms for different, I mean, for notes, I followed one platform, for video lectures, one platform, for revision videos, one platform. Yes, so that's how I studied basically. So for MCQ discussion videos, nothing as such. And question bank, I solved both prepladder and marrow. Okay. So yeah, talking about rapid revision, I didn't say this. Okay, by Sarjit Singh sir. So his revision videos are such that he has tried to incorporate every detail, everything that he has explained in his um, these many hours of video lectures. Almost every point has been included in his revision videos also. So it is a very quick, I mean, you'll be able to finish ENT in just 8 hours time. So yes, you can definitely watch his videos. It's a very good idea if you're planning to do it. Okay, now coming to the third subject, community medicine. For community medicine, I had followed printed notes of Vivek Jain sir. Okay, so entire SPM has been summed up in just 300-page copy of prepladder. Okay, so just a 330 page. So yes, every word is important and every sentence is important, and especially the way he presents everything, that is god level. Have you seen Vivek Jain sir's presentation, his slides? You can also study from his slides. So yeah, very beautiful. Okay, and video lectures, again, of course, I followed him. Vivek Jain sir. For revision videos, I followed prepladder RR. Okay, I watched prepladder RR 2 to 3 times maybe. Yes, again, I'm a fan. Okay, plus Marrow's Mukmohitsar's video. Okay, so Mukmohitsar's revision videos plus MCQ discussion videos. You can watch both of them. They are just so good. She's the main reason why I could retain SPM. Okay, I studied SPM from Vivek Jain sir. I studied SPM from Mukmohit sir, but I retained SPM because of Neha Taneja ma'am. Okay, so it is very important, to revise. Yeah, so Neha Taneja ma'am conducts 1 hour classes, okay, free classes. So in our time also, she used to conduct like from 9 a.m. to 10 a.m. live classes. She used to conduct leaderboard challenges. So that is what kept me in the race. Okay. Otherwise, SPM is a subject ki today I'll be studying a very easy topic and I'll be forgetting that inevitably after a week. So yes, you need to be in constant touch with the subject. So definitely I would recommend you watching Neha Taneja ma'am's videos, just like Priti Sharma ma'am, right? So yes. Now question bank. Question bank. I solved prepladder, and I watched MCQ discussion videos of Neha Taneja ma'am. So yes, I was in this habit of solving MCQs as well. So that is how I did my third year subjects. Okay. Going to the fourth year subjects. So coming to the fourth year subjects, so let's begin with surgery. For surgery, I had followed printed notes of prepladder by Pritesh Singh sir, and I also watched his video lectures. For revision videos and MCQ discussion videos, I had followed Rohan Khandelwal sir, and I had become a very big fan of Rohan Khandelwal sir after I watched his MCQ discussion videos plus the revision videos. Okay, for question bank, I have solved marrow again. Okay, so yes, MCQ discussion videos of Rohan Khandelwal sir. Try to watch it 1 month before the exam or 1.5 months before the exam. Very high yielding. Okay, second subject, obstetrics and gynecology. For obstetrics and gynecology, I had made handwritten notes of marrow by my favorite Sakshi Arora ma'am, very much in detail, right? Extensive lectures and video lectures. I watched her video lectures. Okay, I watched her revision videos. I watched her MCQ discussion videos, and today I'm not in a position to answer you which one was better, whether her video lectures or revision videos or MCQ discussion videos were better. I do not know because all were equally good and all were the best. Okay, so I again solved question bank from Marrow. Talking about the third subject, pediatrics. So for pediatrics, I had followed printed notes of prepladder by Meenakshi Botra ma'am, and I also watched her video lectures. And I watched Marrow revision videos. There are just 3 videos, Nikki. 1 hour, 1 hour videos. So yeah, so that's all of Marrow revision videos, and no MCQ discussion videos as such. And for question bank, I followed prepladder. Okay, I solved prepladder question bank. So this is something I want to tell you, that pediatrics is the shortest subject. Okay, so the least amount of time that you need to dedicate to a subject is pediatrics, and then is radiology. Okay, if you're studying radiology ekdam in the beginning, like I did, that was a mistake, of course. Then of course you would need more time. But try to study radiology towards the later part, because after you've done the rest of the subjects, radiology becomes a cakewalk. If you're taking radiology upfront, then definitely you'll have to invest good amount of time. Okay. Now again coming back to pediatrics, what I was saying is, yeah, so these are the important topics. I've just tried to um, jot down the most important topics according to me. Okay, so yeah, growth and development, where the milestones also come, definitely. So growth and development, neonatology, everything about neonatology. Actually, maximum questions, if 7 questions are asked, so 4 questions will be asked from neonatology, definitely, right? So all the scores, down score, Silverman score, and I don't remember. So all those scores are very important, and entirety, okay, neonatology in entirety is very important. And SAM, severe acute malnutrition, breastfeeding, fluids. Okay, from systemic pediatrics, what is important is this: cyanotic heart disease and acyanotic congenital heart disease. So that TOF and everything, yes, that is also covered in radiology, right? So yeah, that is very important. And cerebral palsy and febrile seizure from neurology. So these are important. And what else? Dehydration, okay, diarrhea. How do you treat no dehydration, some dehydration, and severe dehydration? So that is important. Okay. Then learn about pneumonia. Okay, and that's it. Asthma not required. Just these are more than enough in pediatrics. Okay, if you get done with these, most of the questions will get solved. At least 90% of the questions will get solved. So yes. Okay. So coming. Okay, vaccination. Vaccination is also important. Okay. Now coming to the next subject, which is orthopedics. I followed printed notes of prepladder by Apurv Mehra sir. Amazing set of notes, definitely. I also watched his video lectures, and I also watched Abbas Ali sir's video lectures. Abbas Ali sir is also my favorite. Okay, so yes, I love the way he explains everything. So definitely Abbas Ali sir's video lectures. And revision videos, I watched both prepladder RR, rapid revision videos, plus snapshot videos, okay, by Apurv Mehra sir. And MCQ discussion videos, I did not watch any MCQ discussion videos as such. And question bank, I again solved marrow question bank. Okay, so coming to the next subject, psychiatry. Printed notes of prepladder by Praveen Tripathi sir. Okay, Praveen Tripathi sir's notes, Praveen Tripathi sir's video lectures, everything is so good. And I didn't watch revision videos. I didn't watch MCQ discussion videos. And every time it would be time for me to revise, it would be from the main set of notes, okay, by Praveen Tripathi sir. Okay. And question bank, again, I solved both marrow and prepladder for question bank, okay. So yeah. Dermatology. Dermatology printed notes of prepladder by Manish Soni sir. Okay, so yeah, printed notes of prepladder by Manish Soni sir. And video lectures, I watched prepladder video lectures. Yeah, mainly prepladder video lectures, but for some topics here and there which I found difficult, I watched from Malcolm Pinto sir, just like orthopedics. Okay, even for orthopedics I mainly followed prepladder videos, but for certain topics which I found difficult or volatile, ठीक है, तो for those topics I watched marrow videos by Abbas Ali sir. So yeah, similar strategies for both orthopedics and dermatology. Now, no revision videos, no MCQ discussion videos. Marrow again, question bank तो marrow से ही. उसके बाद coming to anesthesia. So for anesthesia, I had depended entirely on prepladder, okay, of Swati ma'am. Okay, printed notes of Swati ma'am, video lectures of Swati ma'am, revision videos of Swati ma'am again, no MCQ discussion videos, and finally I solved question bank from prepladder. Okay, and radiology. Radiology to printed notes of prepladder by Khalil Ahmed sir. So I had notes of Khalil Ahmed sir. Okay, printed earlier he was in prepladder, but now we have Zainab Vora ma'am, right? So I watched her video lectures, I watched her rapid revision videos, I watched her snapshot videos. Okay, जब जैनब वोरा मैम का मेंशन आया है, so जैनब वोरा मैम is conducting all subjects revision class, all subject, like 19 subjects revision classes by Zainab Vora ma'am. You cannot ask anything more, right? During our time when I was preparing, I didn't get much of Zainab Vora ma'am because she was pregnant, no? Now she is back, so please, and she's also conducting classes. I mean, what more can you ask from her, right? She's conducting revision classes for all the 19 subjects, so please attend her class. And yes, this is your best chance, right? And for question bank also I followed prepladder. Okay, and only we are left with medicine. So I want to say again ki I didn't study medicine, okay, from any source whatsoever. I just solved question bank of marrow, that too not all the topics, only selected topics. Okay, selected topics, the topics which I have already mentioned in my ultimate NEET PG strategy video. So those topics are important. Okay, so only for those topics I have solved the question bank of marrow, and whatever questions were asked in the GTs, in marrow GTs from medicine, only those and plus previous year's topics. These many topics if you do, or these many questions if you do from medicine, that will be enough for medicine. Please do not stress about medicine. Okay. Remember, medicine, most of the questions get solved if you are confident with subjects like physiology, pathology, microbiology, and pharmacology. That's it. Okay. And just here and there about ECG, you need to know about the clinical cases of ECG and acid-base balance, and renal tubular acidosis, and acute kidney injury, Little syndrome, Bartter syndrome, Gentleman syndrome, that one. And your kidney is over. Similarly, from respiratory, you just need to know pulmonary hypertension, ARDS. That's it. Okay. So here and there, just the superficial points, you just need to know them, and your medicine will be over. So just do not stress yourself out कि medicine कैसे पढ़े हो जाता है medicine. Just आपको GTs देते रहना है, और GTs में देखना कि कैसा कैसा क्वेश्चंस पूछ रहे हैं. सॉल्व प्रीवियस क्वेश्चंस में देखो कि कैसा क्वेश्चंस पूछा है. द क्वेश्चंस आस्क्ड आर ऑथेंटिक टू मेडिसिन और आर फ्रॉम अदर सब्जेक्ट्स लाइक माइक्रोबायोलॉजी एंड फिजियोलॉजी. फ्लो वॉल्यूम कर्व से क्वेश्चन पूछा तो वो मेडिसिन का थोड़ी ना है, वो तो उसका है ना, फिजियोलॉजी का है ना. सो अंडरस्टैंड कि मोस्ट ऑफ द क्वेश्चंस विल गेट सॉल्व फ्रॉम अदर सब्जेक्ट्स. सो मेडिसिन को टॉपिक्स तो हार्डली बहुत कम है. तो या so that was all about my resources for final year, third year, and second year, and first year. Okay, bye bye.
I hope you enjoyed the video and gained something new from this, and if you did, please feel free to give a big thumbs up because it always really means a lot when you do. Till then, Dr. Aindrila signing off. Meet you very soon in the next video. Bye bye.